Hello, this is Anne de Geest, and due to popular demand, I'm going to be doing a quarterly update on what's happening with COVID, but also other interesting clinical and medical data that may be interesting to you. So this time I'm going to be focusing on the latest vaccine, the latest update on long COVID, and since obesity is linked to COVID, I basically did a special on GLP-1, the weight loss wonder drugs. So let's get the show rolling. So on the good news side, the wastewater level are low, but they seem to be a sign for a bounce for the winter. So we'll see where that takes us. The latest vaccines are working with the latest variants. We'll spend a bit of a deep dive on the latest variant. Vaccines data is showing it decreased the risk of long COVID. So you really want to take your latest vaccine and keep up to speed. Also, recent data show that inhaled infection can be avoided if you hold your breath for 5 seconds because it quickly dropped after 5 seconds. And the GLP-1 wonder drugs for weight loss have new data on cardiovascular protection, but there's some question about the long-term cost and effect. The bad is multiple reinfection increase your risk for long-term healthcare complications as well as long COVID risk. We'll spend some time on the fact that ultra-processed food is 60% of American diet and why that's a bad thing. And the ugly is up to 23 million Americans have now long COVID. And I'll do an update on the latest clinical information there. It's really slow progress in that sector there. So let's take a quick dive. Right now we have given up on tracking the infection rate. CDC and some of the other sites have shut down their tracking for COVID infection rate. So the only thing we have left is wastewater. And the wastewater, you can see this biobud.io website there. You can see there's a bit of an uptick there going on, so we'll see where that takes us. What's more interesting, when you break it down into the alphabet soup of variants that we're dealing with, you can see how quickly over a period of 3 to 5 months we have a change on the latest variants. The new one that we're following right now in yellow is the EG5. And you can see it's clearly taking over, probably in the next few months will be the dominant variant. If you look at the variant right now, you can see EG5 is been growing up, and then this HV1 is also growing up. The one that people are worrying is the JN1, and that's right now in France, for example, and that is a new mutation that is a follow-on of the BA286. And the reason why people are worried about this is that it has over 30 mutations, which is what happened with Omicron. I had also a lot of mutations there. So right now, it looks like the vaccines are working for this variant there, but you can see the virus is really mutating in new ways there. Most of the boosted, the latest vaccine have been developed on the XBB.1.5, and the EG51, the red one here, is the one that's dominant there. So we need to keep track of where this virus is continuously mutating. It's like a whack-a-mole. The good news is that the Moderna and Pfizer came out a month ago. It's designed against that Omicron mutations. The good news, so far it looks like all the new mutations, the latest ones, are working. The vaccines are working against this mutation there, but it only gives you protection 2 weeks after you've had your vaccine injections there, and probably for 3 to 6 months, no longer than that. If you have had an infection of COVID, you should wait 90 days before getting a new vaccine. And the reason is that otherwise you won't build as many antibodies because the body thinks that you're having another infection attack and you won't build the antibodies. So it's important to wait. And you have protection from the prior infection. People are recommending mix and matching. So if you had Moderna, try Pfizer, or vice versa there. And the mRNA seems to be showing a better T cells response. Novavax is a new one that has been approved. It's a non-mRNA approach. It's more the traditional vaccine approach, which is doing a recombinant protein there. It has a lower risk of complication, for especially myocarditis, which is inflammation of the heart, and supposedly less side effects in the first 48 hours after the injection. I personally, I took the Pfizer one because it was the only one available, but more importantly, I mean, there has been 400 million doses given in the US, so lots of safety and efficacy data where Novavax is more recent. So another good news is that if you're taking vaccination, they have seen that one of the benefits of the vaccine is reduced heart attack and stroke incidence. And so that's kind of an interesting study that came back for people who had an infection. And you can see if you had a vaccination there, you may still have some symptoms from COVID, but you don't have some of these really nasty complications. Also, vaccine is showing a drop in long COVID risk, and you can see that 0.64, so it's a drop of around 36% of getting long COVID. So if for any reason there, long COVID is a nightmare, we don't have a good solution yet, and I think it's going to take a long time. So, keep your vaccine up to speed just to protect yourself against long COVID. The more vaccination, the lower the risk. So this is a study showing people who have had 2 and 3 doses. And you can see that people had a much lower risk in the red where I have highlighted there, significant lower risk of having any type of complication by getting COVID. So children also have a lower risk with vaccination. Again, same type of data there. So, please keep your kids vaccinated. So what's confusing? Well, unfortunately, COVID symptoms now have evolved to be really like the flu. Congestions, runny nose, sore throat, dry cough, at times. So if you're having those symptoms there, and we know the flu season is going to start, you should really test yourself with the antigen test. And remember, the antigen tests are probably not as good as they were because of the variant mutations. And so repeat it maybe a couple of days apart just to make sure that you don't have COVID as opposed to just a cold. It's not pretty unusual to have a loss of taste and smell. If you have a stuffy nose, which you can get with COVID and the flu, the FDA panel recently came out saying that oral epinephrine does not work. Now, it can be confusing there because this is the Sudafed PE that's over the counter that you can buy without going to the pharmacist, or the Mucinex and the Benadryl. It doesn't really do anything as far as constricting your blood vessels there to narrow them and providing relief from the congestions. Now, pseudoephedrine, which was the Sudafed that is now behind the counter there, so you have to ask for the pharmacist and show your ID. I mean, literally it takes a couple of minutes. That is still effective. You have to keep an eye with heart rate and blood pressure if you have hypertension there. There's also decongestant spray. They work, but they're short acting. And these are the famous Flonase, Nasonex, or Afrin will be another one. And you can take this, for example, to go on an airplane to basically provide decongestions during the flight, but you cannot take this for more than a few days, otherwise you'll get a rebound, which makes it worse. So just a quick update there, since COVID and the flu have now similar type of stuffy nose symptoms. So this is an interesting article in Nature that shows that with the latest COVID, the highest risk when you're near somebody is 5 seconds. And the particles falls within 2 meters, assuming there's no wind there. So if you really think you're in a situation there where somebody is suspicious there, move to the side opposite the wind, so the wind goes the opposite direction there. Maybe hold your breath for 5 seconds, which nobody will notice, and try to keep a distance of at least 1 to 2 meters if you can. So I found that as we're trying to go back to a normal life, this is kind of a useful tip if you get suspicion of somebody is coughing and huffing. So if you have had multiple infections, and pretty much not close to the majority of Americans have had at least 1, if not 2 infections there, the reason why you should still worry, despite the fact the symptoms are getting milder, is because you still have higher risk of complications in kidney, cardiovascular, diabetes. And you can see here on the right, 1 infection is in green, 2 infections in red, and 3 infections in purple there. How that's basically increase what they call the burden, which is basically the risk of getting a complication there. So it's 3 times higher risk for lung and heart disease if you have had over 2 infections there. So just keep that in mind. It's still a good idea to avoid getting COVID again. Long COVID is still a major concern. 23 million Americans, roughly 7% of infected adults. Vaccination is still the best protection right now. The top syndromes is the brain fog, and what is worrisome is that we've seen this in the past in prior videos I've shown, is that there's an alarming change in the brain size and cognitive function. So it is literally physically attacking the brain. there is a famous post-exertional malaise, which means you exercise and you literally crash for several hours, if not several days there. So mastering your activity level is really important there. And then one of the classic symptoms is what's called POTS or dysautonomia, which is when you sit and you get up there, you suddenly have a drastic heartbeat increase and dizziness because the autonomic nervous system does not adjust the heart rate and blood pressure as you're changing position. That's a classic syndromes. Treatment there, we haven't come up with the magic bullet. You still have to do rest and pace yourself, managing your energy. Which has been shown that people have hyperinflammation from activated mast cells, so some drugs that people are using there that seems to be effective. Doing a lot of daily breathing exercise if you're having any type of lung limitations there. And it's very important to reach out for help to avoid social isolation. There's a lot of depression. Higher risk, we're going to talk about that, is people who have had multiple infection. After the second and the third, you may be fine with the first and the second there, but your risk of getting long COVID goes up. It has been now shown that people with asthma or any type of allergic retinitis, are also at higher risk. And recently, it has come up that people who have had concussion, migraine, or minor autonomic symptoms are also more vulnerable there. The NIH, if you remember in my prior videos, got $1 billion and they ran out of it. And honestly, in my opinion, there's very little to show for it. Now they're going back to Congress to try to get what's called a long COVID moonshot for $1 billion per year. I just think that the private sector is doing a much better job at tracking this down. But that's just me. So what's happening with long COVID? Data just showed up for 2022 when we had a full year of data. And you can see that the population that was most at risk is the 18 to 34 and the 35 to 49 years old. Pretty much the kids and the children there had a lower incidence rate and prevalence rate. But you can see the peak is between 18 to 64 years old. It has had an impact in the UK, for example, where they think that a lot of reasons why people have long-term syndromes are correlated with the long COVID. So what's happening with long COVID? And again, I have done some deep dive in prior videos there, but I'll do a quick oversight of what the latest things we have discovered. Unfortunately, it's a multifaceted. If you remember, the virus goes through our body for the ACE2 connection, which is the cells that's in the epithelial cells there, and it kind of enter through the nose. The problem is these ACE2 cells are everywhere in the body. So the virus basically is going into multiple locations there, which is why you have this over 100 symptoms that people are complaining for. And you can see it is the epithelial cells, which is pretty much everywhere in the body, in the heart, in the small intestine, in the kidneys, in the testes, in the blood vessels, in the liver, inside the lungs, in the alveoli, and all of that. And that's why we believe that some of the reason behind this is that the virus is still there. And there has been, if you remember, autopsy have shown in the past that up to 270 days after the infection, they could find traces of the live virus inside multiple parts of the body there. What we believe is happening, this is the latest one, this could still change, is that there's autoimmune dysregulation. And this is, you can see where at times you can reactivate a dormant virus that's been sitting there. There has a lot of problem in the microbiota and the virome. There is a lot of problem into immunity there with the heart rate and blood pressure going all over the places. Blood clotting, could create problem everywhere for the body there. But the biggest problem is the neurological system. It is really a neurological disease. So this is a seminar that's organized by all the leaders that are doing long COVID, and they have like a monthly update. So I just grabbed some of the slides there. This is from David Petrina, who gave an update from the Mount Sinai Hospital. And they see this is typically what they have to do a full checkup on these patients there. First, they do blood testing panels to look at hormone level. Cortisol, for example, has been found to be abnormal in people who have long COVID. They see if there's any potential dormant virus that got activated. So this is the co-infection syndromes there. Then they do more blood testing panel to see if there's problem with coagulations, a problem with inflammation, which is usually the cases there. Then they basically do the symptoms burden, which everybody has, these questionnaires, which all have now been quantified and validated there. So I'm just kind of give you the heads up of what people have to go through when they go to these long COVID clinics. As needed, they can do EKG, ECG, CT. You can see there's a long list of things. So this is a major, major checkup that they're trying to understand what is happening to the body. Now, there's some good news if you know people with long COVID, is that they're starting to show that if you could provide support to the endothelial support, remember that's where the virus goes in there and damage the endothelial there. There are certain things that seems to be helping, like curcumin, 500 milligram, can reduce some of this inflammation marker. I can never say it. Resveratrol, which is what came from the blood, but from wine, can basically activate some of the arterial blood flow. Statins have shown to have some protective effect. There's also other things that have shown that supplements can break down clots if people have been diagnosed or have small clots there. So you can see that we're starting to find some type of mechanism to treat some of this blood clot problem that people may be having after the infection. They usually use some type of enzymes and antiplatelet therapy. Of course, this has to be done under supervision of a doctor there to make sure that you're having the right window there. These are very narrow therapeutic windows there. So the good news is that they're starting to really having some effect with a multiplicity of drugs. Another thing is that if you have 23andMe, you may find out you have Neanderthal ancestors. I do. And it turns out they have discovered that you are at a higher risk. Now, if you have 23andMe, you may want to see if you have this toll-like receptor TLR7. It's a rare variant. There's a typo here. And it's a 5.3 higher risk. No, that's the negative news. The good news, if you have type O bloods, it seems to be more protective. So we're starting to learn more about the genomics, and I'm talking about people, we're getting hospitalized. So what are some of the long COVID symptoms and pathology? And you can see why the clinical profession is really struggling, because it's everywhere. People have symptoms of chest pain and palpitation, and 10% of the cases they find out people have myocardial inflammation. It is really important, if you have had some symptoms of long COVID, usually at 3 to 4 months after the infection there, and you have any type of cardiac palpitation, all that, get yourself checked, because unfortunately, I know several people there who had massive heart attacks because they didn't get themselves checked. They were young, therefore they were, not at risk, and so that is treatable, and that's roughly 10% of the long COVID cases. A lot of people have problem breathing, and it's usually some gas exchange problem there. People that start developing diabetes, type 2 diabetes there, because it damaged the pancreas. People start developing autoimmunity disorders there, and then problem in the intestinal tract. Neurological system is the big problem. Brain fog, confusion, cognitive losses, lack of sleep, memory loss. I mean, these are all based on all this neuroinflammation for the whole body there. People have had some kidney injuries there. There's a lot of, because of the problem in the blood vein distributions there, people are fatigued, and then also problem in the reproductive system. It is a nasty thing. And the reason why you worry about it, because the hazard ratio, which is the average, is called 1. You can see how these people have significant problem with pulmonary embolism. That's 3x. That's pretty high. Cardiac arrest and all of that. So really, if you have symptoms, get yourself checked, and really, there's more and more ways that we can start to minimize some of the symptoms there. Some good news, metformin, which is used for type 2 diabetes management, seems to decrease the symptoms of somebody who has long COVID. So this is after somebody has been diagnosed, and they put them, and they try 3 different medications, metformin, ivermectin, and fluvoxamine. The only thing that worked was metformin. And so you may want to, ask your doctors, to see if you can experiment with that if you have symptoms. So how do we live with COVID? You have to be aware. I still wear N95 in crowded indoor conferences there when I know there's poor ventilation. Check, your local wastewater to see if there's an uptick, especially in the next couple of months with Thanksgiving coming up. Stay current on your vaccination. Get the latest one. Remember, it's not just to avoid symptoms of COVID, but to decrease the risk of long COVID. If you get reinfected, to avoid getting long COVID, get Paxlovid. You have to check for contraindication. There are some people there on statins there who cannot do that. Avoid exertion while infected. It is really important there. When you test negative with your nose, you're still infecting the rest of your body there. And so it takes maybe 4 to 12 weeks, depending on the people there, to really have the immune system to clear the virus. It's really important in that recovery period there. You really take it easy, avoid strenuous cardiac exercise, help your immune system to flush the virus out. So let's talk about the wonder drug GLP-1. We know that COVID is linked to obesity, so I'm making the link because everybody thinks this is the cool drug. So I was going to do a quick overview of that. These drugs were developed to help manage blood sugar for the diabetic population there. And we have discovered that people lose up to 20% of their body weight. And so as a result of that, people are trying now to use this for obesity. It's typically an injection once a week under the skin, so it's not that pleasant, as far as doing this on a regular basis there. There is a long list of products. I'll let you look at this. Ozempic is the one you probably have heard the most about. That's on the market. How do they work? So GLP-1 is a hormone that's made inside the small intestine, and it is the signal that the body sends to the pancreas to release insulin. And insulin is the hormone that regulates the glucose from the food that you're eating. It lowers the amount of glucose after you get a spike after you're eating there. This also is blocking what's called glucagon. And glucagon is another hormone that basically adjusts blood sugar level when needed. And also more important for obesity is slowing the stomach emptying. It gives you that feeling that you're full for a longer period of time. And it also sends a signal to the brain, we'll talk more about it, to basically says that you're basically full and you don't want to eat more. And basically this GLP-1 medication bind to the GLP receptors to trigger the release of that hormone. The higher the dose of the medication, the more extreme the effect. So you really want to titrate low first, get followed by a doctor, make sure you know what you're doing, and then slowly titrate upwards. So this is a graphic that shows that not only is it impacting the management of glucose in the body there, but it has a lot of impact on the brain, the heart, the liver, the pancreas, and the GI tract. So as I just mentioned, the big initial target was the pancreas to optimize insulin synthesis and secretion. But now we also discover it's slowing down the gastric tract, so it gives you that sense of fulfillment there, send a signal to the brain to say that everything is fine, but it also has positive effect on the brain as far as decreasing neuroinflammation, all of that. So it looks like a wonder drug. So let's spend a bit more time on it. So the initial results were showing a drop of 20% of body weight. Now remember, these are people who may have like 80% excess body weight. And so these are people with BMI over 35, if my memory is right. And you can see you had that drop there, which really got the industry very, very excited. But this was over a short period of time, like, 52 weeks is roughly a year. So the latest results that just came out a couple of days ago, and this was on 17 patients using Wegovy, from Novartis. And they did a population of people with BMI over 33, 82% had coronary artery disease. So these are people who are at cardiovascular risk, and 68% had prior heart attack. What they discovered is that for that population, and that population is at a very high risk for another heart attack, and so it was kind of a nice way in a period of 3 years to see if you could have an impact on cardiovascular. And it decreased major cardiac event by 20% and stroke by 7%. And you can see the placebo here in gray, and then the drug, you can see over a period of time, there was really a split that it's kind of clearly effective for that. It also had a lower progression to diabetes. So instead of 12% of the placebo group that over the 3-year converted into diabetes, only 3.5%. So that's really successful. However, only 1.5 patient per 100 patient was avoided a deadly event. And the question is that if we have to pay $48,000 over a period of 3 years for that per patient there, can we justify this cost for the whole population there? And I think that's where you're going to see a lot of the payers having issues in reimbursing for this or putting some very tight criteria there. The body weight loss was only 8.5%. And so as a result of that, people say, well, initially it's 20%, but over 3 years, it dropped to 8.5%. And so the question is, what is really the long-term effectiveness of these drugs? What we know is that if you stop taking the drug, you will go back to where you were. So this is a lifelong decision there if you want to lose that weight. So the concern is that at the cost of around $1,400 per month therapy, and some concern about muscle mass and bone density, which we have to do more long-term study on, can we afford to do this, or is the consumer willing to pay cash for this? So to be seen. So as a result of that, I also took a look at ultra-processed food, which is what leads to a lot of this obesity and overweight. And the US is the winner, unfortunately the bad winner, of being 60% of our diet is ultra-processed food. I mean, it's kind of the worst in the world. And that is a big problem there, because now we're talking about really addiction to this ultra processed food. And one of the problems with those products is all the fast food industry is that the food particles are so tiny there, it gets digested in the stomach before it gets into the large intestine where the microbiome resides. And that on the average could be 100 to 300 extra calories per day. And that is what kind of leads to some of this excess weight over time. This was a very big study that was done by the NIH. They spent like $189 million, my tax money at work. And they are basically recruiting 10,000 adults to follow up over the next 5 years. So if you're interested, I put a link here. And they do give money to volunteers between $300 to $2,000, depending how much medical tests you're willing to do there. There was this very good review in the British medical journals there, BMG, on ultra-processed food and how it impacts the body. And I won't go into all the detail, but pretty much at the high level there, you can see this processed food drastically increase the cardiometabolic diseases across the whole body there. And it's a combination of the food additive, the contaminant from the processing, the fact it's a lower nutrition quality because it hasn't been processed so heavy. It's usually too high in sugar and salt. And you can see that it is really linked to a lot of this obesity problem we have in the US. This is another review of all the publication in the last couple of years, and it was in a book by Chris Van Tulloken that really showed that ultra-processed food strongly associated with increased risk of pretty much everything you can think of, from depression to inflammatory bowel disease, to cardiac diseases, to type 2 diabetes, hypertension, just name it, it's there, even dementia. So it is something that you may want to look at your diet. So this is again my pleasure to help the community. I hope you enjoy my video. If you like it, please post it to your friends. Give me a thumbs up on YouTube, and stay healthy, and I'll probably see you in a few months. Take care.